Omaha says they need money to pay for things associated with the COVID-19 pandemic. Some are worried they'd be completely left out of funds from the CARES Act. Senior reporter Jake Wiskowski explains what the City Council did and who's taking notice.
The Omaha City Council unanimously approves a resolution to tell the state of Nebraska and Douglas County they need their share of the money from the CARES Act to pay for things like PPE, extra cleaning, and other related pandemic expenses. Because Omaha has less than 500,000 people living within the city limits, they weren't directly eligible for funds. Yet it makes up 25% of the state's population and 80% of the counties.
And while there were initial concerns about what we were hearing as a council from the state and county level, I think it is important in a collegial way to make the friendly ask to highlight and underscore the important part that the city plays in the county and in the state's health.
The state can get up to $1.9 billion, and Douglas County is eligible for $160 million for coronavirus expenses. Douglas County Commissioner Chairman Claire Duda told the City Council he wants to make sure everyone in the county gets their fair share. He hopes they initially do a plan for any entity in the county that has incurred out-of-pocket costs.
I am absolutely committed to making sure that Omaha's expenses are met. I hope you will see that you are made whole, not for your revenue loss, but for your out-of-pocket expenses.
Governor Pete Ricketts says he's working with Mayor Stothert to get Nebraska's money to Omaha, but it's unclear how much. Council members wanted to send a clear message. They need to share.
It's very comforting to hear your comments. We appreciate you coming down here and expressing those. But I will say it's also nice to have that on the record.
Commissioner Duda said they hope to have public hearings on the funding at their May 19th board meeting for the Douglas County Commissioners. Reporting in downtown Omaha, Jake Wiskowski, 3 News Now.
The CARES Act money would only go to coronavirus expenses and not any revenue lost during the pandemic.